This is Kim Yee. She's the #1 tennis player for 16s, and I'm going to be working on her today at sports at my clinic with her she got some right elbow pain, some right shoulder pain, and we're going to treat this and see if we can make her feel better. Why don't you lay back for me? So basically what we see a lot of times, and I see a lot in my practice, is tennis players, they'll come in with elbow pain, and a lot of times the elbow pain is actually coming from we call proximal weakness. And so we are addressing her shoulder with exercises for to strengthen her proximal joint to help out with the distal joint, her elbow. But we're also going to be working on some scar tissue. She's had this for a long time. She probably has some tenderness in here. Yeah, right. There's a ligament here that she's kind of stretched out a little bit too. She has a little bit of laxity there. So we'll be careful that we don't continue to stretch that out, but we are going to work on this this muscle right here. So this is the, we have two types of cream. We have the regular strength, which gets really warm, and then we have another cream that's a lot less activated, and we won't use that with Kimberly. We're going to use this one first. And I usually take about the size of a dime and put it right on the blade here. This is the blade that we use. There's two types of blades. There's this one and then this one here called the bone. I'm going to use this one to start off with. And what we're going to do is we're just going to scan the area, and you can actually kind of feel the areas that have scar tissue that we need to break up. And I'm sure Kimberly,
you can definitely feel it.
Yeah, you can feel it. Yeah, you definitely can feel that. And what we're going to do is we're going to just keep on going over. Now this technique's been around for 2,000 years, but what we did is we combined a mechanical apparatus. At the same time, there's a chemical with the cream, and so together they work out pretty powerful. So we're just going to do this. Now we're going to put a little bit of a stress on the muscle to bring it out to the surface. We're just going to work that area a little bit, and we're just looking for some redness, which she's going to start to get. I'm going to dig in here a little bit. You okay?
Yeah.
Just going to go here, and now I'm going to even work on her lateral extensors, and she's got some right there. Feel that, huh? Mm-hmm. So we're going to work that a little bit. And the more chronic the problem is, the more resistance you're going to feel in that muscle. We're just going to work on it. And this technique can be done, she can actually do it herself, but it's a lot easier if I can get in here and work on there. Feel that right there? Mm-hmm. And as we're working on it, we're increasing the circulation, increasing what we call vasodilation. That's why it's getting a little bit red. And we're going to be working this whole area up and down. And what we're trying to do is try to get it so it's nice and smooth. As you can, if you were listening, you could hear that it's not getting as gritty as it once was. It's getting a little more smoother. That's it. And then that's all for today with that. And I usually tell my patients that it's going to get a little warm, possibly, especially when they go in the shower. It might get a little hot. If she wants to activate it, she can use a hair dryer. That will activate it, or a warm cloth. A moist cloth will activate the medicine also. That's it.